The science of acne. What research actually reveals about clear skin. Right now, someone is vigorously scrubbing their face, thinking they're fighting acne. In reality, they're making it worse. Another person just finished their third round of antibiotics for persistent breakouts, unaware they've created resistant bacterial strains that will haunt them for years. What if everything you've been told about treating acne is incomplete? Today, we're going beyond surface-level advice to explore what peer-reviewed medical research actually reveals about this condition affecting over 85% of people at some point in their lives. The hidden cost of common treatments. Let's start with a hard truth backed by science. Some of the most popular acne treatments create long-term problems while providing short-term relief. According to research published in Dermatology and Therapy, aggressive cleansing disrupts the delicate balance of your skin microbiome. Your skin hosts hundreds of beneficial bacterial species, what scientists call commensal microorganisms. Studies demonstrate these protective bacteria form your first line of defense against inflammation and pathogenic invaders. When you aggressively scrub or use harsh cleansers, you're essentially sterilizing an ecosystem that took years to establish. A 2024 study in the International Journal of Molecular Sciences found that this disruption can actually increase inflammation and make skin more vulnerable to the very bacteria that cause acne. Now let's talk about antibiotics, the treatment millions receive each year. Research published in the journal Dermatology and Therapy in 2024 reveals a concerning pattern. While antibiotics like clindamycin and tetracyclines initially reduce acne lesions, they cause what researchers call collateral damage to the skin microbiome. A comprehensive review in Cell and Bioscience documented that antibiotic use, even short courses, creates resistant bacterial strains. These resistant bacteria don't just affect your skin, they can colonize your gut and respiratory system. The Centers for Disease Control estimates antibiotic resistance causes a death every 15 minutes in the United States, making this a critical public health issue. The irony? After antibiotics clear your skin temporarily, the resistant bacteria often trigger worse breakouts than you started with. Understanding the real problem. To solve acne permanently, we need to understand what's actually malfunctioning, and the answer isn't on the surface of your skin, it's beneath it. Research published in Experimental Dermatology and the British Journal of Dermatology identifies acne as a chronic inflammatory disease of the pilosebaceous unit, the structure containing your hair follicle and sebaceous gland. According to studies in the Journal of Investigatory Dermatology, this isn't a single problem, but rather 5 interconnected processes occurring simultaneously. First, excessive cell proliferation. Your skin produces too many cells, creating buildup that has nowhere to go. Second, follicular hyperkeratinization. These excess cells form plugs in your pores, creating the foundation for comedones, what we recognize as blackheads and whiteheads. Third, inflammation. Studies published in the Indian Journal of Dermatology show that inflammatory markers like interleukin-1 activate before visible lesions appear, suggesting inflammation may actually trigger acne rather than result from it. Fourth, bacterial proliferation. Cutibacterium acnes, previously known as Propionibacterium acnes, colonizes the blocked follicle and releases enzymes that break down sebum into inflammatory fatty acids. Fifth, sebaceous gland enlargement and excessive sebum production. Research in PMC journals demonstrates that enlarged glands produce more of the waxy substance called sebum, creating an ideal environment for bacterial growth. But here's the critical insight from decades of research. These 5 processes aren't random. They're all triggered by deeper hormonal and metabolic imbalances. The androgen pathway. Let's examine the first major pathway, androgens. Research published in JAMA Dermatology and Frontiers in Immunology reveals that sebaceous glands are extraordinarily sensitive to androgens, hormones like testosterone and dihydrotestosterone, or DHT. A landmark study in JAMA Dermatology from 1999 examined androgen metabolism in sebaceous glands and found something fascinating. These glands possess all the enzymatic machinery to convert weak androgens into potent ones. Specifically, the enzyme 5-alpha reductase converts testosterone into DHT, which is approximately 10 times more powerful at stimulating oil production. According to research in Frontiers in Immunology, when androgen levels are elevated, three things happen. Sebum production skyrockets by up to 90%, sebaceous glands physically enlarge, and skin cell production accelerates, creating the perfect storm for acne. But why would androgens be elevated in the first place? For women, research published in multiple studies, including those in Scientific Reports and the Journal of Ovarian Research, points to polycystic ovarian syndrome, or PCOS, as a major culprit. This condition affects 6 to 20% of women of reproductive age and is characterized by ovaries producing excessive androgens. A meta-analysis examining data from 240,213 patients found that acne prevalence among women with PCOS reaches 43%, significantly higher than the general population. The telltale signs include persistent facial acne, thinning scalp hair, and unwanted facial hair growth. Here's where the research gets particularly interesting. According to numerous studies in Frontiers in Endocrinology and BMC research, PCOS itself is fundamentally driven by insulin resistance, a condition where your cells become less responsive to insulin, forcing your pancreas to produce more. Research published in Vivo and multiple PMC journals demonstrates that elevated insulin directly stimulates ovarian cells to produce more androgens, while simultaneously reducing sex hormone binding globulin, the protein that keeps testosterone inactive. The result is more free, active testosterone circulating in your bloodstream. This explains why addressing insulin resistance often resolves both PCOS and acne simultaneously. Studies on metformin and lifestyle interventions consistently show that improving insulin sensitivity reduces androgen levels and, consequently, acne lesions.
The estrogen pathway. Now let's examine the second major pathway, estrogen dominance. While androgens receive more attention in acne research, studies published in Gloam and the Indian Journal of Dermatology reveal that excess estrogen can also trigger breakouts, particularly in women. Research in Frontiers in Immunology shows that the liver plays a crucial role in metabolizing and eliminating excess estrogen. When liver function is compromised, whether by fatty liver disease, alcohol consumption, or cirrhosis, estrogen accumulates in the bloodstream. Furthermore, studies document that the liver contains an enzyme called aromatase that can convert testosterone into estrogen. When this enzyme becomes overactive, even people with normal testosterone levels can develop estrogen-related acne. According to research in multiple medical journals, several common medications elevate estrogen levels. Calcium channel blockers used for hypertension, certain antibiotics, alcohol, proton pump inhibitors for heartburn, and various antidepressants. For people taking these medications, acne may be an unexpected side effect of disrupted hormone metabolism. Interestingly, research also shows that estrogen-related acne often follows menstrual cycle patterns and may appear predominantly on one side of the face, corresponding to which ovary is more active that month. Evidence-based solutions. Now for the solutions, backed not by anecdotes but by peer-reviewed research. For androgen-related acne, starting with insulin resistance. A systematic review published in the Journal of Ovarian Research examined multiple intervention studies and found that lifestyle modifications, including low glycemic diets and regular aerobic exercise, significantly improve insulin sensitivity, reduce androgen levels, and decrease acne severity. Research consistently shows that reducing refined carbohydrates and sugars helps stabilize insulin levels, which cascades into improved hormonal balance. Next, vitamin A. Published research in StatPearls and Drug Bank explains that isotretinoin, the synthetic vitamin A derivative marketed as Accutane, works by reducing sebaceous gland size by up to 90% and normalizing skin cell differentiation. However, it comes with serious risks, including teratogenicity, meaning it causes severe birth defects. Studies published in multiple journals suggest that natural vitamin A from cod liver oil may provide benefits without the severe side effects, though the evidence is less robust than for isotretinoin. Vitamin A helps regulate the enzyme that converts testosterone to DHT. Vitamin B5 research, a clinical trial published and reviewed in JAMA Dermatology Open, tested pantothenic acid supplementation in adults with mild to moderate acne. After 12 weeks of taking 2.2 grams daily, participants experienced a 67% reduction in skin lesions. Researchers believe B5 works by regulating coenzyme A metabolism, which is essential for both fatty acid processing and sex hormone production. A systematic review in JAMA Dermatology examining nutraceuticals for acne concluded that B5 shows fair quality evidence for efficacy, though higher doses than the recommended daily allowance are typically required. Zinc research. A systematic review and meta-analysis published in Dermatologic Therapy analyzed multiple studies comparing zinc supplementation to controls. The findings were clear. Patients treated with zinc showed significant improvement in inflammatory papule count. The analysis revealed that people with acne have significantly lower serum zinc levels compared to healthy controls. According to the research, zinc works through multiple mechanisms. It reduces the activity of 5-alpha reductase, the enzyme that creates DHT, exhibits anti-inflammatory properties, and promotes wound healing. Studies using 30 milligrams of elemental zinc daily for 12 weeks showed meaningful results. For estrogen-related acne, liver support through cruciferous vegetables. Research published in multiple nutritional biochemistry journals demonstrates that compounds in cruciferous vegetables, particularly indole-3-carbinol and its metabolite, DIM, help the liver metabolize and eliminate excess estrogen. A review in dermatology journals notes that concentrated DIM supplements provide approximately 25 times the potency of dietary crucifers, with clinical observations showing improvements in estrogen-dominant acne. Research on stinging nettle root, published in herbal medicine journals, indicates it may help regulate estrogen metabolism and reduce inflammatory markers, though clinical trials specific to acne remain limited. Critical treatment considerations. According to the American Academy of Dermatology guidelines and multiple research reviews, the most effective approach combines multiple interventions targeting different pathways. Research emphasizes that supplements work best as complements to not replacements for medical treatments when acne is severe or scarring. For moderate to severe cases, consultation with a dermatologist is essential. Conclusion. Here's what the research fundamentally reveals. Acne isn't a surface problem requiring harsher scrubbing or stronger antibiotics. It's a signal, a visible manifestation of hormonal and metabolic processes occurring deep within your body. Studies published in over 100 peer-reviewed journals over the past 2 decades consistently demonstrate that sustainable acne treatment requires addressing root causes, insulin resistance, hormone imbalances, and microbiome health.
The treatments I've discussed today aren't experimental. They're supported by systematic reviews, meta-analyses, and randomized controlled trials published in journals like the British Journal of Dermatology, JAMA Dermatology, Frontiers in Immunology, and dozens of others. Your skin is your largest organ, and research shows it's constantly communicating about your internal health. Those breakouts aren't random bad luck. They're precise biological signals pointing towards specific imbalances that, once corrected, can transform not just your complexion, but your overall health. If this evidence-based approach changed how you think about acne, let me know in the comments which strategy you're most interested in trying. And if you know someone struggling with persistent breakouts, share this with them, because this research-backed information could save them years of ineffective treatments and unnecessary frustration.